In 1814, a Russian poet wrote a fable entitled The Inquisitive Man, which tells of a man who goes to a museum and notices all sorts of tiny things but fails to notice an elephant. In October this year, NHS England used the theme of Elephant in the Room to initiate a community-wide movement highlighting the importance of muscles, bone, and joint conditions to living well. So what's this elephant in the room? Well, can we start with a quick show of hands? How many of you in the last week have had any pain affecting your neck or your back or your muscles that has impaired your ability to carry out daily activities? Well, there you go. In fact, 1 in every 4 of you is likely to visit your GP complaining about pain in your back, your neck, or your muscles and bones. An estimated 14.9 million adults in England alone suffer from a musculoskeletal condition. My name is Nupur Kohli, and I'm going to tell you what we are doing at Raft to help those suffering from these conditions. Well, musculoskeletal is a broad term, but the one tissue that is most commonly affected is your bone. In fact, after blood, bone is the second most commonly transplanted tissue. The current gold standard for treating bone defects is to use patients' own bone from another part of the body, usually from the hip. But as you may imagine, that procedure has lots of disadvantages, including limited availability, and there's pain and damage at donor site. The alternative is to use bone from bone banks or synthetic sources, but there's always a risk of infection or rejection. So we have developed a novel biomaterial called SmartCap that can be used as an off-the-shelf product, encouraging body to make bone naturally over time. So what's unique about SmartCap? Well, first, SmartCap is made of a natural protein called fibrin, and it's coated with calcium and phosphate, which is the mineral found in your normal bone tissue. And secondly, with bone, and like with many other tissues in your body, it's all about how well the blood vessels will grow into the implanted biomaterial. We believe SmartCap, once implanted into a bone defect, would attract the blood vessels that would bring in the desired nutrients and cellular cues for adequate healing to take place. Not only this, when combining stem cells with SmartCap, we have seen promising results in the lab with signs of bone formation. So the way Raft is addressing the elephant in the room is by developing this novel biomaterial that will have multiple applications as a bone void filler, completely eliminating the need for bone grafts. So what's next? We are currently raising funds for the preclinical testing of SmartCap, and I'm certain with your support we will be one step closer in bringing this new treatment to millions of patients who are suffering from debilitating musculoskeletal conditions. Thank you very much for listening.